Gardner Health Center as a clinic began really in 1971. Came out as a result of studies, epidemiological studies that were conducted in the late 60s, early 70s that indicated that the infant mortality rate was much higher within the Latino community, particularly in the Gardner community. And comparing to all of the communities in Santa Clara County, that was the one that has the most need in terms of medical services.
A group of students were very actively involved in community medicine issues, and they decided that they wanted to work to start a clinic in the Gardner area. When I was smaller, I grew up in the Gardner area off Prevost Street. And my mom and I would go to church at the Sacred Heart Church. So it was very much part of my heritage as such that community was an experience I had when I was young.
Sacred Heart Church was very, very intimately involved in providing service to the community via Father Moriarty, who was giving us the facilities for us to deliver the services there in the church, but also was instrumental in advocating for funding, to get funding resources from the county, state, and federal government.
The Monsignor of Sacred Heart, Moriarty, had closed their Catholic school. So when we first got there, the first location of the Gardner Clinic was actually in one of the classrooms of that school. And I remember us going in there, looking at the room, deciding how to divide it up into cubicles, and going to the hardware store and buying plaques or boards to put up for rooms, etc. In the first summer in 1971, when we first started what was eventually to become the Gardner Clinic, we had one classroom, and we had volunteer doctors and students. And that summer, that was the Gardner Clinic.
You know, we've grown significantly since we began, but overall, it's a round figure. We see about 35,000 people in a year. That translates maybe to 150,000 visits of all types.
We provide medical services, dental services, optometry services. We have an in-house pharmacy. We also have a WIC program, Women, Infant, and Children's program, that focuses on making sure that individuals have an opportunity to have healthy babies.
We have a large OB program. I think we represent about 24% of the OB deliveries at Valley Medical Center, and that's really significant. But we've had special programs that help seniors throughout the city of San Jose who live within the city and have Medicare. That's a unique program, only available to San Jose and three other cities throughout the nation.
We've also offered a variety of what we call behavioral social services. Our mental health department is one of the biggest in the county. We have counselors, psychiatrists, psychologists on staff.
I was a little facilitator. You did everything yourself. All that belongs to you.
When I arrived here, I was emotionally, spiritually, and mentally bankrupt. I had very little hope. I didn't know what was wrong with me. All I knew was that nothing worked in my life. And I think that if I can say anything about Gardner, with everybody that's been part of my recovery, they've provided tools for me, and nobody's ever given up. There were so many times when I wanted to quit. I wanted to quit life. I had no reason to go on. And then I would come here 1 or 2 times a week, and a completely different perspective, was shown to me.
Overall, the clinic function is not just taking care of the sick people. We give them a hand to help. We give them extra help when we can. We never say no because they can't pay, because they're late, or because of whatever reason. We don't say no to anybody. The message is we do care about people. The purpose we work here because we care. Many of our patients take 1 or 2 buses to come here. And they late half an hour, even 1 hour. And if you tell them, you know, or you behind, you late, and we have to reschedule them to another visit, they will not come. Because it's very hard for them to get 2, 3 kids dressed up, get into the bus and get here. Maybe they take 2 buses, and then you tell them, we're not going to see you today because you were late. They won't come back. But we always said, let we find out what we can do for you. Sometimes you have to wait 1 or 2 hours. Sometimes we see you right away if you're not busy, but we don't so now.
Muchas familias están muy agradecidas, se encuentran con Clínica Gardner, porque esta clínica, además de que a uno lo atiende bien, se preocupa mucho por sus pacientes.
There was a family that came in to receive services at one of our clinics, and the family had brought in a little boy that had Down syndrome, and the little boy couldn't sleep at night. He had some problems with breathing at night.
Cuando llegué a Clínica Gardner, allí encontré al señor Ignacio Pérez. Esa persona para mí, pues para mi familia, contó mucho porque él tuvo mucho interés, tomó en este niño.
He needed to be operated. I took time off on my own and spent some time with that family trying to help them through this process.
Recuerdo que esa vez este niño no podía tomarse su líquido porque después de la operación, porque quedó él muy adolorido de su garganta y no tragaba nada. El señor Ignacio llegó a visitarlo, le llevaba regalitos y luego le dice, hijo, tómatelo. Y él viéndolo, pues qué bien, él le dio unos ánimos que se los levantó inmediatamente. Este niño tomó su alimento tan fácil, tan bien.
I think the people at Gardner really look at it being more than just a job, and you know, to coin a phrase, it's more of an adventure, because I think people go beyond the call of duty to try to really help people. I think a lot of people within the organization maybe have either gone through the experience or really feel that the folks that we see is the type of people they want to provide services to, because a lot of our folks either don't have money or can't access the services because of language.
Over those 30 years, there's been a lot of lives that have been affected in a very positive way because of the services that we provided. And I'm very excited that we'll continue to provide and build the legacy of providing services to the community within the next 30+ years as well.
These 30 years has been a tremendous change, a tremendous learning curve for all of us in delivering services to our communities. And I think there is so many people that have participated in making what Gardner Family Care Corporation is. There are so many people that have devoted their time, energy, and commitment that it's so satisfying to see the dedication of our management team, of our employees.
We're about giving hope to people who many times may not have it. And if we can, you know, impact one person at a time and give them the hope to keep going, we're being successful.